Hi friends, Pradeep Pendyala, Professor of Anesthesiology. Today I am going to talk something about off-pump CABG, off-pump coronary artery bypass surgery. Friends, off-pump CABG is done on beating heart. Yes, you heard it right. Off-pump CABG is done on beating heart without cardiopulmonary bypass, and it is less invasive approach to surgical revascularization of the heart with definite benefit in high-risk patients. Interestingly, the real benefit of off-pump coronary artery bypass grafting may be seen in high-risk patients, including women. Now that's very interesting, ain't it? Well, operative mortality in women undergoing on-pump, that means normal CABG, may be as high as twice that of men, whereas the operative mortality in women undergoing off-pump CABG is equivalent to that of men. Off-pump CABG with no touch technique of the aorta is ideally suited for patients with porcelain aorta, in whom manipulation of the aorta is impossible. In addition, patients with history of cerebrovascular accidents, renal disease, or bleeding dyscrasias may be of huge benefit from off-pump techniques. Now let me explain a bit more. Now, the development of advanced epicardial stabilization device such as octopus facilitated coronary artery bypass grafting without the use of CPB, also known as off-pump coronary artery bypass, OPCAB, off-pump coronary artery bypass. This type of retractor uses suction to stabilize and lift the anastomotic site rather than compress it down, which allows for greater hemodynamic stability. Now, although OPCAB was initially proposed for simple or two-vessel bypass grafting in patients with good left ventricular function, it may be the sicker, older patients who benefit most from avoidance of CPB. The surgeon may be using intraluminal shunt to maintain coronary blood flow during the sewing of distal anastomosis. Let me explain more about how the entire surgery takes place on off-pump, this amazing surgery. How does it take place? The surgery is performed using a full sternotomy in order to reach all the areas of the heart. Manipulation of the heart is facilitated by the use of suction devices, a soft cup-like device that allows movement of the heart is utilized on the left ventricular apex to manipulate the heart. The target vessel is then further immobilized. The target vessel is further immobilized utilizing a foot plate device with multiple suction pods. The arms of both suction devices are fixed in space to the sternal retractor, and which could be adjusted as needed. In this fashion, the target vessel is immobilized. In space to facilitate the anastomosis by the surgeon. This is the amazing method. Obviously, the performance of off-pump CABG requires manipulation of the heart while maintaining hemodynamic stability, and this is the kind of surgery which takes place. Patients with extensive coronary disease, particularly those with poor target vessels, may not be good candidate. Off-pump CABG may decrease the incidence of post-operative neurological complications and the need for transfusion relative to conventional coronary bypass grafting. I hope you liked this small brief introduction of off-pump CABG, and I can tell you more about it, but I really wonder whether you will be interested more and more about it. So I'll briefly talk about off-pump CABG. That off-pump CABG is less invasive method for coronary revascularization with definite patient benefit, including less manipulation of the aorta, avoidance of complications associated with cardiopulmonary bypass, fewer blood transfusion, shorter hospital stay, shorter duration of intubation, reduced pulmonary complication, and reduced costs. What else do you want more? This is off-pump CABG for you. Thanks for patient listening. Until next time, take care. Goodbye.